Good morning, everybody. Dr. Vuong here. Today is August 29th. This is your quick COVID update. I'm going to do just a weekend wrap up because the numbers don't really matter on weekends. But I will say that yesterday's number for Saturday, 89,000 cases. You know, the day we were talking about 190,000 cases. So not every county reports on the weekends. But I want to remind you, last weekend, the weekend numbers were like 55, 60,000 cases, both Saturday and Sunday. And for a Saturday to have 89,000 cases, I was quite surprised. So we'll see what happens tomorrow. And then remember my video from a couple of days ago on a Monday number. I mean, it was like 260,000 cases last Monday, which was reported on Tuesday. So if that becomes the trend, it's not going to, we're not heading in the right direction. In other words, Florida judge has thrown out the governor's no mask mandates, so schools are allowed to put masks on. I will tell you, it's probably a little too late. School has already opened. You already created this debate, and that's really separated the country. And that's kind of the thing that really bothers me. It's not so much that people don't want to wear masks. It's just that it's really been politicized, and now we're just not thinking clearly. And my heart goes out to my heart goes out to the country, because we are just really divided over a public health pandemic that we don't need to be divided over, guys. The court systems will rule in favor of masks and doing what's right for public health. So it's shown this time and time again. And businesses are legally allowed to require masks, are legally allowed to require vaccination mandates. So it doesn't matter what your governor thinks. So if you're going to get it in the future because you got to go back to work, you work for the military, you work in a hospital system, you work in a school system that's going to require it, might as well as get it now. Might as well as get the vaccine now. Why be stubborn? Because all you're doing is delaying how much time it will take for you to get fully protected against the wild type virus. And as new data comes in, like for example, the CDC showed that in unvaccinated people, Delta doubles your risk of being hospitalized if you're unvaccinated. And don't believe that my friend's mother works in a hospital and it's all vaccinated people. That's what you want to hear. It's not true. There are some vaccinated people, but trust me, 95% of the people in hospitals right now are unvaccinated. 95%. And they're getting younger and younger. And so that's just the truth. So the courts, court system is going to allow mask mandates, vaccination mandates. So you might as well just get vaccinated, man. Just do it now. If you're going to get it a month from now because you got to go back to work, why not just get it now? Just get it now. So help us get over this. It will spread up the eastern seaboard, North and South Carolinas, catching on fire, Tennessee, Kentucky, and it will hit New Jersey. And New Jersey is the most densely populated American state. And New York City eventually, just in time for the winter, yay! And we are starting to see the effects of things like Sturgis. Vaccinations are safe for pregnant women. If you're currently pregnant, it does not cause you to lose your baby. Babies are not born with monkey tails. In fact, the data is very clear. It's the unvaccinated pregnant women who are having problems, complications, early birth, pregnancy termination, stillbirths, increased stillbirths, guys. And let me break down that word for you, stillbirth. It is a baby that you're giving birth to and that's dead. And because you didn't want to get vaccinated. It's increased stillbirths in the unvaccinated moms. This is horrible. It hurts my heart to even have to say that to people, So if you are currently pregnant, speak with your OB-GYN, but they will probably recommend you get a vaccination. And every now and then I get this question, Dr. V, what about these doctors who don't recommend the vaccinations? Well, if your doctor doesn't recommend a vaccination, it has to be specifically for your situation, okay? And if you're talking some talking head that broadly kind of like dismisses it, or is, there's that Arkansas doctor who was prescribing ivermectin and stuff. There was that one ER physician who was selling letters so that kids didn't have to wear masks at school. For $50, he was selling letters. I was laughing about that with Erica. I was like, only $50? You're going to put your license and career at risk for $50? Like, that's stupid. How many are you going to sell? 100? Like $5,000? That's like 3 shifts, two shifts for you. Like, why would you do that? Makes no sense, but people don't think straight. So let me ask you this question. What physician in his right mind would go against what every medical professional society has recommended? Vaccinations, masking, those of every major professional society has recommended vaccination for everybody, right? So it doesn't matter if it's the family physician group, the internal medicine group, the surgical group, the OB-GYN group, every major professional society has recommended vaccination. But your doctor is so smart that he or she does not recommend it. And what's going to happen when lawsuits come down? Here's what happens with a lawsuit. If a doctor gets sued, they have to show what's called standard of care. And if the standard of care is basically in your community, because it could vary a little bit by community. In your community, if this is how a certain operation is performed, or this is the treatment that is used for pneumonia, then you've got to show that you meet that standard of care. Well, one of the burdens of meeting a standard of care is to say, hey, I follow the recommendations of the CDC, the FDA. I follow the recommendations of my professional societies, my professional organizations. I did my CME. I went, I'm up to date with my continuing medical education units. And this is what's recommended by my professional societies. And you think you're onto something because you heard some doctor not recommend, or your cousin told you their doctor doesn't recommend it or is against it? Yeah, right. That ain't happening. Trust me, that's not happening. No doctor in his or her right mind right now is going to tell a patient who qualifies, because there are people with allergies, etc. But if you qualify for a vaccine, there is no doctor in their right mind that's not going to recommend the vaccination right now. It's ludicrous. It's crazy. Not going to happen. So I wouldn't give much credence to these physicians or doctors or whoever you're listening to. And it's never the doctor. It's always like, oh no, it's my sister or my cousin's friend or some video. You have to remember when the pandemic first started a year and a half ago. There was that viral video of two doctors saying that this is a hoax and the hospitals are empty. And that video went viral and was taken down. People kept sending it to me. I'm like, stop it. And so they chased down these 2 doctors. Turns out these two ER physicians, who remembers this video, owned a ER room, ER thing, or health something, and they were losing business, and so they had a financial gain. Eventually, those doctors, I don't know what happened, but they were discredited, and then it's been shown one of the major, if not the major, doctor spreading misinformation is fucking some chiropractor or whatever. I don't even pay attention to it, quite honestly. And he's selling alternative remedies. I ain't fucking selling you anything. I don't know what to tell you. Last year I had COVID rapid test kits that I put together, Erica, myself, and Erica's mom. and no one else had them. Eventually, I sold them for $50 a kit, which pretty much paid for the cost of putting them together. My cost for acquiring them. You don't know my fucking cost. People are like, that's too expensive. Well, you don't know how much they cost. And then it comes out, Costco was selling them for like $125. I mean, if you wanted to travel, airports were selling them for $250. And people still got all bugged and bothered at me. I'm like, dude, fuck you, man. Like, dude, like, calm down. This is a whole different pandemic. Everything you think you know so much about is just slowly fading away, man. What's your reason? Ivermectin is not, I've been saying this for a long time. Ivermectin makes no sense. All right, who remembers back in the day, hydroxychloroquine was the big thing. Trump was still in office. He was promoting hydroxychloroquine. Turns out he owned stock in the company. And I have a video and I was like, there is nothing. It makes no sense why hydroxychloroquine would help in a virus. Turns out no one fucking uses hydroxychloroquine, guys. Like every major study, every analysis of hydroxychloroquine shows that it does not work. If you're in the hospital right now, I promise you are not getting hydroxychloroquine. And I said the same thing about ivermectin. I was like, this doesn't make any sense. And then it turned out, people are like, look at the data, look at the data. These fucking like internet researchers, right? Keyboard warriors, like, oh, you don't know your latest up to date, Dr. V. You should do your own research. Ivermectin. And then like the major study that these people were using to promote ivermectin turned out to be completely 100% falsified. Like data made up. There was no study. There were no patients. Completely made up. And now we have people, because they're spreading misinformation, people are scared, man. Now we have people getting poisoned by taking fucking horse doses of ivermectin, which is a dewormer for horses and cows. It's fucking stupid. And not only do we have calls to poison control centers, we've got people actually in hospitals because they're fucking puking their guts out, getting really sick because they've been taking ivermectin. And, it's really stupid. So if you, and let me, one last thing about like, Dr. V, you need to be like promoting nutrition. Dude, nutrition is a lifelong thing. That's what novel coronavirus means. You need to take your vitamin D and take this supplement and, a natural God-given immunity. That will work. Said no fucking Aztec person. No Mayan chief ever said, just use your immunity to fight off the smallpox. How did that work out for the Mayans? How did that work out for the Native Americans against, smallpox and measles? What is wrong with y'all? Of course I'm all about nutrition and I promote healthy eating and healthy lifestyle, but not against a fucking novel coronavirus that you have no prior immunity to. Now, it helps. That's the whole point about, what happened last year. This is a disease of old people. And I was on camera saying, dude, we have obesity in America. We have people with comorbidities. This is gonna be bad if you're obese. Who remembers this? At no time did I say, oh, nutrition doesn't matter. But dude, it's like Hurricane Ida is about to fall on New Orleans and you're like, hey, hurricane's coming, let's put up an umbrella. No, you effing evacuate. You pack up all your crap and valuables and move it to higher land. Get out of there. This is not the time to sit there and be like, oh, I'm gonna dig this ditch around my house. Like, what? No, you get the fuck out. You do what's right. So what is right now? What is right is, one, calm the fuck down, get your vaccination, quit spreading misinformation, and and be patient. Wear a mask, smile with your eyes. I wear an N95 now. I stopped indoor dining. I'm fully vaccinated. Everybody around me is fully vaccinated. We've stopped going to museums. We don't do indoor activities anymore. we're just waiting it out. I'm lucky. I have a nice pool. I hang out. I've started cooking at home. We made nice fajitas last night. It was good. Stay calm, man. It's all right. I'll be back tomorrow with another rant, I guess.